Hi, I'm Dr. Tegan Moore, the Executive Medical Director for Wheelhouse Center for Health and Wellbeing, and it's cold and flu season. And a lot of my patients have asked me recently if I have any tips or tricks above and beyond some of the internal treatments that we're doing to help to reduce ear infection risk or to clear clogged, funky feeling ears. So I'm gonna make some faces on film today to demonstrate a technique that helps to keep your eustachian tubes clear and to keep drainage going down into the throat from the inner ear to keep that pressure from building up. There's 3 techniques that I'm going to show you today. First, let's talk a little bit about the ear. So we have this nice deep inner ear that moves down into our skull, and then we have a little tube called the eustachian tube that drains that inner ear down into the back of our throat, and there is actually almost like a little flap that protects that opening. And what should happen is that flap should open when we need to sort of rebalance the pressure inside the inner ear. It should be draining any excess fluids from the deeper inner part of the ear as well. So if you're having a lot of colds and congestion and things, it should be draining those fluids down into the throat as a way of keeping that clear from bacterial infection from happening in that area. But what can happen is that flap can get a little bit sort of jammed up or clogged if you have a lot of mucus and it doesn't open properly, and then you start to have this buildup of fluid and pressure in the inner ear, and it can be really uncomfortable. So here's some techniques to help to relieve that. The first is literally just like you're going to blow your nose into your hand. You're going to gently squeeze the nose closed and then blow into it. Oh, this whole side just opened. So you can feel, usually if there's not a whole bunch of pressure and mucus built up, that's pretty much the only thing you're gonna need. A nice nasal spray, some immune support, and then that technique just to keep things moving if you feel like you have a little congestion inside the inner ear. For some people, it's much more chronic and we need more of almost like a physical therapy routine. I would recommend 10 reps, 3 sets, and you can do this multiple times per day to keep the inner ear draining. So the funny faces. First, you're going to pull out your ears. Then you are going to open your mouth nice and wide. Then you're going to keep your ears out and you're going to jut your chin. I'll show that from the side. Open, jut the chin. Open, jut the chin. And I know it looks really silly, but you can feel the whole inner ear, that all of that draining down into the throat if you've had a lot of congestion. And if you do that routinely, along with anything else that I've prescribed to you in terms of nasal sprays or immune support, it can be really beneficial. And you can use that, like I said, with kids who are prone to ear infections if you see them getting a cold, so that things don't get too cloggy in there. And then the third thing that you can do is basically just a lymphatic drainage technique, where basically you're just going to massage up and then into the eustachian tube area and then down the side of the throat. So up and then down, and then you can do both sides. And you would want to do at least 10 repetitions on both sides. You could do that either before or after our ear pulling and chin jutting. And between the two, you should really keep things moving this season while you have a cold or flu. If you have any additional questions, please contact me through Wheelhouse, and I wish you an abundance of health this season. Okay, bye-bye.